the 13th. Welcome back to Wave 3 Listens. And we've talked quite a bit here lately about dementia, memory loss, and how can you handle that? This is a tough issue. But with me now is someone who is an expert in the field, Ben Zaabani. Ben, welcome to the show. You are with, you're a memory care facilitator, so this is something you deal with all the time for Riverview Village.
Yes, sir.
Okay. When I read memory care facilitator, you're the person who, when someone comes in and has issues with memory or dementia, you handle their care, right? Is that correct?
Yes, in a point. When a person comes in with dementia, will be myself plus the interdisciplinary team. We all look at that person to see if they will be eligible to be admitted in the unit, if they meet the criteria to be admitted in the unit. And also, after they are admitted, I continue by putting an activity program together just to ensure that their dignity and to maximize their dignity, productivity, and quality of life.
Before we get into the specifics of your facility, and I'm anxious to do that, I'm eager to do that,
sure.
I'm curious, what are some of the red flags at home for folks, whether it's themselves, their parents, their grandparents, what are some of the indicators that perhaps we may have an issue?
Probably the most common indicator is memory loss. They start maybe forgetting, turning the stove on, putting something cooking, then they turn around doing something else, and they forgetting the car keys, where they put it. That's pretty much the memory loss is the main indicator that there is a problem there that needs to be addressed. As far as diagnosis goes, for Alzheimer's, for example, to diagnose Alzheimer's, they have to do what we call MRI, image of the brain, to determine if there is a problem there. So basically the main indicator, like I said, is the memory loss.
Memory loss,
yeah,
okay.
Start noticing some memory loss, some more forgetfulness, more confusion. Sure. Yeah.
Okay, and your goal at Riverview Village, is that to slow the process down? Can dementia, can Alzheimer's be treated? Is it treated with medication? Is it treated with therapy? How do you treat it there at Riverview Village?
Well, Alzheimer's, so far, there is no cure so far for it. It's a progressive degenerative disease that affects the brain. But however, the goal in the cottage unit, in the Augustus cottage unit, or the program on whole, is to provide those patients with a home-like environment, just like I said, to maximize their dignity, productivity, and quality of life. There is some medication that they use to slow down the disease, and we can use those also. We have a physician on board and a whole staff that will look into that. If
you just joined us, we're talking to Ben Zaabani. Ben is with, he is a memory care facilitator with Riverview Village. I want to talk to you a little bit about that. You mentioned the cottage, and I love the word you use, dignity. I think for our loved ones, all of us are interested in retaining their dignity. This is very important to you.
Yes, sir.
Very important to you. I noticed that was one of the first things you talked to me about. How does that home-like environment, A, retain their dignity, and B, tell me what really separates the cottage from any other facility that someone might go to?
Well, for the cottage, is we can separate, like I said, it's more what we are trying to create as American senior community. We are trying to put in place a philosophy of a social model than a medical model. They still receiving the medical attention they need. However, we pay more attention on the social model by creating an environment like a home-like environment, just helping them feel safe, feel comfortable. That's the main focus that we strive for.
And trying to keep them engaged, I would think.
Yes.
So let's say someone who's watching right now has a family member with dementia, or maybe they're a little bit alarmed they may have Alzheimer's. With that being said, what is the first step that you recommend, Ben? Do they give you a call? Do you recommend them bringing their loved one to the facility and seeing? And tell us a little bit more about the cottage. I've asked you a couple of questions here, but tell us a little bit more about that as well.
Yeah.
First step.
First step, if there is a problem, like I said, if there was a definite diagnosis of Alzheimer's or dementia and the family are unable to care for the person at home, because when an individual is affected by this disease, they start having some problems, and it might be a little bit hard for the family to care for them at home.
Sure.
They might then looking at an alternate placement.
All right, and there's the information on the screen.
Yeah.
Now, when we mentioned the cottage is that a different segment
Yes.
of Riverview Village? A different,
Yes.
living
It's a different setup. It's a different unit that's specialized only for people who are affected with Alzheimer's and dementia.
And I do think it's worthy of that, because it's
Yes.
totally different. And I've noticed, too, when I've talked to folks about medical professionals, doctors, about dementia, about Alzheimer's, it's very important to keep them engaged. And isn't that important to you as well? If they have an interest, you can focus on that interest
Yes.
and talk to them in that way.
And that's what we have the program in place, is work together to the cottage journey. So we can work together with the family, with the patient. We work with them. What we do is we try to observe the patient closely to develop an individual plan of care for them that concentrate on things that they used to like before, just to keep them engaged in as far as activity goes.
You know, and this conversation has been very serious, Ben, but on the lighter side of it, I can tell you enjoy being with people. There's probably some very bright spots. Yeah. I would assume you have a lot of fun there at Riverview Village,
Sure.
right? Correct? Yeah. A lot of fun activities?
Yeah, sure. We have a lot of fun. We do, with them, we have games, we have exercises, physical movement. We do art and craft with them. We do cognition reminiscence. We do sorting and matching things, just colors, different things. We do relaxation, some music relaxation. The activity varies during the day. It depends on what they feel, what they like, and what that moment they are in. So we put in activity plan for them from the time they get up in the morning to the time they go back to bed at night.
All right, we kind of focused on Alzheimer's here, and it is Alzheimer's Awareness Month, so that's why I kind of had that focus. And of course, that is what you do, that is your focus. So with that being said, though, I want you to know that Riverview Village is much more than that. If you can check them out, let's throw up that information again on the screen. If you have a loved one who perhaps, you know, getting to be a little bit much for you to handle, you love them so much that you want them the very best of care, there's the phone number there. There also is the website for you to check out, Riverview Village on Eastern Boulevard in Clarksville. All right, coming up, IU football tickets. Indiana's 1-0. They are having a winning season so far. You can go to a game absolutely free next on Wave 3 Listens.